Good afternoon and welcome back to Facebook Live. This is our Friday, June 12th segment here on the Oneida Nation Reservation. I'm Bobby Webster, the Director of Public Relations, and today I have a few guests joining me. Debbie Danforth will be giving our medical update. Trish King, our treasurer, will also be doing some information for small business, what's available, some of those things. And Jeff Bowman, the president of Bay Bank, is here to talk about some of the services that Bay Bank has to offer the community, as well as some of the impacts of COVID and what that means to them. This week, the business committee did extend the declaration of public health emergency here on the reservation, as well as the Safer at Home declaration. Now, what this means is that we're going to continue to be under the Safer at Home and the public health emergency. We're going to continue to move forward. This does not mean anything is closing up again. I repeat, this does not mean closures. It means that we're going to continue on our path to recovery in a very calculated and strategic fashion. We're going to move forward with opening our businesses when they have their safe and their health plan that's been approved by our medical team of professionals and the business committee. The playgrounds are now open and the parks. So make sure that when you do take your children, your family, visit those areas, that you still continue to wipe your hands, to wash, to disinfect, to sanitize. That's still very important. Just because something is open doesn't mean that you no longer have to take those precautions. We're going to continue to make sure and encourage you to always take those precautions. As usual, we get questions. When is bingo going to open? When is the casino going to open full blast? And we do have some information. Gaming management has plans to submit the next phase of their reopening public health plan to the business committee later this month. And the plans are to reopen bingo and some of the table games at the end of June. So stay tuned. We hope that it's approved, and we hope their plans are in order and that we can once again enjoy the game of bingo. Retail will also be opening some of their stores. They're going to recover a couple of locations that will be posted on our website when they get ready to do that. That does not mean the gaming portion of retail is going to reopen. Only the convenience stores and the smoke shops. So mainly they're looking to expand the sales of our gas station, convenience stores, and smoke shops. As always, we do want you to keep your comments and your questions relevant to the presenters that we have here today, as well as please be respectful and mindful of everybody here on our panel. One last thing before we go into our medical update is that we have been advised that Oneida management, our operations, are working on putting together a report and some diagrams on the state of operations, what areas are functioning, what positions are being manned right now. We get a lot of requests, and this is a huge undertaking. We have hundreds of departments and employees and services that we're trying to consolidate and that we're working to put together in a well-designed graphic. It's not going to be a one-pager, I can guarantee you that. It's going to be several pages. When that information gets ready, we will also post that on our COVID website, as well as make it available online to you. So we're working on that. Hopefully we get that done within the next week or so. As I said, be patient. It's a very large undertaking to get all these moving parts in order so that we can provide a good project chart for you to see where people are and what's being used, what services are available. So with that, I think we're ready for a little good news, maybe, Debbie?
I'll try. Thank you, Bobby. Well, good afternoon. Just want to go ahead and start with the update on our numbers in terms of the status of positive cases. So globally, we're at 7,540,679 positive cases as of today, with 421,856 deaths. Within the United States, we're at 2,023,347 positive cases and 113,820 deaths. Within the Indian Health Service overall, we're at 14,136. Albuquerque is at 844. Bemidji area, which we are a part of in Minnesota, Wisconsin, and Michigan, is a total of 277 positive cases. And the Navajo Nation, please keep the Navajo Nation in your prayers. They are currently at 7,190 positive cases. The Phoenix area is 2,773. For the state of Wisconsin, we currently have 21,926 positive cases with 682 deaths. Brown County is 2,421 with 38 deaths, and Outagamie is 306 with 8 deaths. For Oneida jurisdiction or Oneida reservation, we have 47 positive cases. Brown County, there's 20, 0 deaths, and 1 case which is still active, which is in isolation. For Outagamie reservation jurisdiction, we have 27 cases with 2 deaths and 1 that is still active and still in isolation. So I just want to touch base real quickly on a couple of updates from the Health Division. I do want to share with the community that the drive-through testing site at the former Woodland Church on Airport Drive is going to be changing our hours of operation effective Monday, June 15th. And we will have that information also out on our websites and on Facebook. But the site is going to be changing hours from 11 a.m. to 3 p.m. Monday through Friday. Basically, we've monitored the flow in terms of the number of patients that we're currently providing and when they normally come into the facility. And so we are trying to accommodate our demand for increased staffing within the health center. And so some of those staffing that are currently operating at the drive-through testing site will be pulled back in the morning hours so that we can assure that we have adequate staffing to provide the needs of the community. So again, the testing site will be changing their hours to 11 a.m. to 3 p.m. Monday through Friday. Everything else remains the same. There's no prior appointment necessary to obtain the testing, and we are seeing Oneida Comprehensive Health Division patients or any employees or anyone from the community. If you do not have a chart with the health center, they will go ahead and perform a mini registration for you right there. We have improved the turnaround times for our testing sites. We are now getting test results back sometimes within 48 to 72 hours. Previously it was between 5 and 7 days, so that is an improvement as well. So we are thankful for that. And overall, since the onset of the drive-through testing, we have performed a total of 611 tests, of which 39 of those have been positive. Also, I just want to touch base real quickly. I know there's been a lot of buzz and a lot of concern within the community recently related to the dental department. So I just want to give you a brief update. If you are in need of dental services, there are some criteria that need to be met in terms of our being able to provide that service. So if you have a toothache, if you have pain, please call the dental clinic and they will go through a process as far as triaging and asking you questions. We don't want you to just walk into the clinic because that causes further delay. So we do want you to call ahead and talk to our dental triage areas. The triage is performed by phone. The dentist reviews the triage information and then makes a determination in terms of what type of treatment you might need. Currently, we are only able to provide urgent and emergent services, and that is determined by whether there's the potential for an active infection within your mouth, if you have facial swelling, or if you have a significant health history like diabetes, or you have immune compromised issues or something like that. That will place you at a higher level in terms of triaging to try and get people in. There is a callback list that we utilize for triage patients along with the patients that need to be rescheduled or canceled. We are meeting on Monday with the dental staff to look at what our next steps are in terms of how we can expand the level of services that we currently have. However, our biggest challenge right now is that we only have 7 staff members in the dental department. 29 of those staff members are currently on furlough or layoff, And so it is a challenge for us to be able to expand the level of dental care services that we currently have on site. But we are going to be looking at that. And the other thing I want to point out is that dental is operating in your mouth. The difficulty that creates is that creates an aerosol when they are working in your mouth, and that enhances the danger in terms of potential exposure to COVID. So that's the main reason why we only have a limited number of staff. They're at a much higher risk in terms of the services that they would be able to provide. But we do have the personal protective equipment available, and so we are going to be meeting with dental to determine how we might be able to expand some of those services to the community. As Bobby mentioned earlier, the Safer at Home order and the public health emergency has been extended to July 12th. And so I just want to take this time to again express the need that personal protection, making sure that you're wearing masks, making sure you're maintaining social distancing, wearing your mask or some kind of a facial covering now more than ever is critically important. I know going out into the public, you see a lot of people that do not have masks on. Just because it's nice doesn't mean that this disease goes away or that this virus is less prevalent in the community. So please remember making sure that you're taking all of those necessary precautions. As things start to open up, even more so important to make sure that you're taking those necessary precautions. So thank you, and I will turn it over to Trish.
Thank you, Debbie. Good afternoon, everyone, and thank you for joining us in Facebook Live today. On behalf of the Oneida Business Committee, I just want to say our thanks and appreciation to some of the funding that we get from the CARES Act. We created for the small business owners a small Oneida Nation Small Business Assistance Program, and this is a grant-funded program for the members. The Oneida Nation has allocated funds to assist member-owned small businesses within the reservation to overcome burdens they may have experienced due to the COVID-19 pandemic. We support our tribal economy by supporting our members, and we encourage our tribal community to do so as well. The funds for this program came from the CARES Act, as I had mentioned, the Coronavirus Relief Fund for tribal nations. The restrictions, there are several restrictions, and they are placed on our grant program due to the requirements that are called for within the CARES Act regarding distribution of these funds. The name of the program, as I stated, is the Oneida Nation Small Business Assistance Program. The program, again, is grant-based to help cover reimbursable expenses made by your businesses during the COVID-19. Qualifications and requirements, again, are very detailed, and so today I just want to bring to your attention that the program is available. There are several eligibility requirements. These will be listed within the application process. They will be listed on the Oneida Nation website as well as Bay Bank's website. The program is directed for Oneida entrepreneurs that are located within the Oneida Reservation boundaries or on tribal lands. The available eligibility can go up to $30,000 per business. And there are several factors that the amount is actually determined from, such as payroll, utility payments, rent, and mortgage payments. The application, again, we are coordinating with Bay Bank, and I want to thank Jeff Bowman for agreeing to take on this duty. The Bay Bank has agreed to coordinate the program. The application and criteria, as I stated, will be available on the websites. The program will begin June 15th, 2020, and it is administered through Bay Bank, and Bay Bank is ready and available, I'm told. Everything is ready to go. So as of June 15th, they will be able to accept your applications. There will also be people available at the bank that can help you complete the application and ensure that you have all of the necessary documentations and fulfill all the requirements that are listed. We as a nation wish you, our small business owners, good luck in overcoming the obstacles placed in front of you during this COVID-19 pandemic. Please stay healthy and keep us informed of your progress. There are many programs that are dealt with, that are available through Bay Bank as well as through the state in regards to small business. It is our hope that this program will fill the gap for those entrepreneurs who were not either eligible or who could not afford the loans that are available through the SBA. So we wish you all best of luck. Don't go. Now I'll turn it over to Jeff to give you some more information.
Thank you, Trish. I wanted to share with the community the impact that the COVID-19 virus has had on the bank, but more importantly, its customers. In the beginning of March, when the crisis started, one of the first things that we did is grant loan payment deferrals to our small business customers, our mortgage customers, and our consumer loan customers. Over 200 customers took advantage of that opportunity to defer their loan payments. There were many people that were laid off and are still laid off during this crisis. We have many small businesses that either had to temporarily close or they had their revenues interrupted and had fewer customers. So we accommodated every customer that asked for assistance. We made sure that we could at least make the loan part of their life easy. We also waived all overdraft fees on checking accounts. That program is still in effect, and our position on that is if you were having financial difficulties and you had an overdraft in the account, we didn't want to make matters worse. So we wanted to make sure that the bank was not earning any fees off of that. We closed our lobbies by the second week of March. This created some interruption for our customers, and we had to figure out how to still accommodate them. All of our drive-through facilities remained open, so every one of our customers got assistance even though the bank lobbies were closed. So to make some of that easier, we made sure that people had access to online banking, to their mobile banking application. We, in the first week of April, launched an upgrade to our website. It included some features, some new products that allowed them to navigate their banking accounts a lot quicker and easier. Another program that evolved during the crisis is the U.S. Small Business Administration, which is a federal loan guarantee program. They partnered with the U.S. Treasury to provide assistance to small businesses nationwide. $350 billion was authorized by Congress to provide what they call the Paycheck Protection Program, also known as the PPP loan. It's a short-term loan that was intended to fund payroll and loan payment expenses during the crisis. Bay Bank was ineligible and is an eligible lender for the PPP program. We got started on it right away when it became available in the first week of April. We are still processing PPP loan applications. The program is still available. We issued 91 PPP loans totaling $11.9 million. One of the things that we're proud of is 7.4 million out of the 11.4 million went to tribal-owned businesses. Serving Indian country in Wisconsin, and Oneida in particular, is in our strategic plan. So the program worked out beautiful for our small business customers. They were able to access financing to get them through the crisis. Also, as the crisis evolved, we made a financial donation to the Oneida Food Pantry. That helped them purchase groceries so that they continue providing their services. And then one of the unique statuses of Bay Bank is we're what's known as a CDFI in the industry. It's a designation that is the Certified Community Development Financial Institutions, CDFIs. We earned that designation last year, and what that designation did for the bank is it made us eligible to receive grants so that we can re-grant those funds to other people and other businesses. The state of Wisconsin has an economic development agency called WEDC. It's Wisconsin Economic Development Corporation. Because Bay Bank had a CDFI status, they approached us and wanted to use us as the facilitator to distribute funds in our local area. The state of Wisconsin established a $5 million pot of money for this program. Bay Bank was awarded $432,000, specifically targeting small businesses that were Bay Bank customers. We ended up giving out $427,000 in grants. It went to 45 businesses. And again, because our focus is on small native-owned businesses here in the Green Bay and Oneida area, 240,000 of the 427,000 went to native-owned businesses. 26 of the 45 grants. So 56% of the dollars immediately went to help local small businesses that are Native American owned in the Green Bay and the Oneida area. Those grants ranged in size from a low of $1,600 to a high of $11,400. And then another program Bay Bank had access to provided some additional financial support. We obtained a $20,000 grant from one of our correspondent banks known as the Federal Home Loan Bank of Chicago. They provided us $20,000. We broke that up into 10 grants and we distributed all $20,000. It included another financial donation to the Oneida Food Pantry and then 6 tribal nonprofits that are customers of the bank that serve their own clientele also received a grant in that $20,000 pot of money. Although it doesn't directly affect the customers of Bay Bank, we're also proud to let the community know that we did not lay anybody off during the crisis. We maintained full employment. In fact, during the crisis, things actually got busier for the bank because we had special loan programs. We had to work with customers on payment deferrals. We also had grants that we had to distribute, so we actually got busier during the crisis. The bank lobbies were closed for about 11 or 12 weeks, and then in fact on this past Monday, we reopened the banks for the first time. So both operations on Packerland and Mason are in full effect. The lobbies are open. We have cleaning and protective gear in place for employees and customers. The drive-thrus are still open, the ATMs are still in use, so we haven't skipped a beat there. So we're slowly going back to, we hope, is a normal situation. And then finally, as Trish mentioned, Bay Bank is going to be the agent to do the grant application processing for the Oneida Nation. The bank is well prepared to offer assistance to any Oneida tribal member-owned business within the boundaries of the reservation, and that is the target market for this program. We've administered a loan program for the nation. We've administered grants for the nation in the past, and we work with a lot of small business customers, so I think we can hit the ground running really quickly and take action really quick to help these small businesses that have been affected by the virus. On Monday, on our website, the application materials will be posted, and the commercial loan department that works with small businesses all the time will be the point people to process these applications. And I want you to know that you will have a good experience with the bank. We're going to do our best to help you, and we'll do everything we can to support you to make sure that things become easier for your small business. And the bank's website is baybankgb.com. You can look for the grant application materials on Monday morning, and we'll be very glad to assist you access funds.
Thanks, Jeff. Thanks, Trish. And Debbie, I have a couple of questions for you, Debbie.
Okay.
First one is, when is the timeline for PT to reopen?
Physical therapy has remained open throughout the whole pandemic period, but they were limited and restricted to providing specific services. Right now, they are providing services to those that are urgent need, They do provide some of those services over the telephone in terms of screening. So if you do have questions, please contact physical therapy directly and they will call you back and talk with you in terms of what your needs are.
Okay, good. And the other question is about testing, and I think we've tried to answer it on in the real time, but there's a question out there whether or not we should encourage testing to more people more broadly. There are some people who we understand are asymptomatic and may be spreading it unknowingly. So what's our position on everybody getting tested?
Well, basically, again, when you do testing, it's only the result at that point in time. So you could be negative today and go tomorrow, and wherever you travel between today and tomorrow, you could have been exposed and you may turn positive. So to be tested for asymptomatic, what we encourage is that if you have a concern or you feel that you may have been exposed to someone, you are able to just go to the drive-through testing and get tested. But we don't really stress the importance in terms of asymptomatic, because if you look at the percentages of asymptomatic testing, there's only about 1% that is asymptomatic.
Okay, and if I was tested 2 weeks ago, is there any reason why? Maybe I think starting to get a little sniffle or something now, maybe I should get retested again?
Well, this time of the year is one of the most difficult times of the year because of the fact that we have a lot of allergies, there's a lot of cottonwood out there, there's a lot of other things that are starting to bloom and come to, and so a lot of people do have a lot of allergies. One of the things that we've tried to stress is that if you have a sniffle, you have a headache, if you take Tylenol or you take an allergy pill and the symptoms go away, that's probably allergies and not COVID.
Good, thank you. Trish, I'm not quite sure how to pose this question, but is Oneida prepared for round 2 financially? Your thoughts on that?
We have been working all of this time, definitely hoping that we don't have to face a round 2. Financially, we will be strapped, I will say that. We haven't recovered yet enough from this first round, and I'm thinking but our strategies, our cash management, our cash planning, and our cash flow is all been monitored very well with the finance team, and we've been able to extend our current situation another 3 weeks, 4 weeks. So as each week goes by and as we get some of these refunds coming in, and some of these other CARES Act funding, that extends our life a little bit longer financially. However, if we are hit with a second round, financially we will be in a real severe financial situation.
So basically it's just like a brand new job. We have nothing in savings. We have very minimal kind of paycheck to paycheck situation, and if we're hit again, it's going to be even more devastating. So if we mind our protocols in terms of the healthcare and the safe distancing, then I think hopefully in our community we'll try to avoid that round 2. However, we know that as the state and other jurisdictions open more broadly, that we're all subjected to that. The more you travel, the more you're going to be exposed to the potential for that COVID to come back at us again. I did want to mention a website if you're a small business. This is for a grant for small business. The Wisconsin Economic Development Corporation is going to be issuing 30,000 grants of $2,500 to Wisconsin small businesses to help them get back on their feet in the middle of this pandemic. So the applications are going to start Monday, June 15th, and they will accept applications through Tuesday, June 23rd. Here is the website: wedc.org/capital W, capital A, capital I, dash, small, dash, business, dash, grant. Again, wedc.org capital W, capital A, capital I, dash, small, dash, business, dash, grant. So 30,000 grants at 2,500 will help a lot of small businesses. I'm sure it's not just an easy application, but you can go to that website, you get more information. So we hope that some of our small businesses are able to get back up and running. And there's a couple of questions about whether or not some of the businesses are going to open in the IMAC, and that's the smoke shop and Fried Bread Heaven. We don't have the answer. We're only going to speculate at this point that when bingo comes back, that those businesses will also resume. So we can't say for sure just yet. Let's see, I do want to thank everybody, all the employees that have kept the wheels on the machine and kept us running. And as Trish said, that if this hits us again, it's going to be a hard road to hoe. We don't have the savings. We don't have a whole lot of gaming revenues that we've been able to utilize just as it comes in. So having gaming opening and expanding our retail a little more is certainly going to help us financially, which kind of brings us around to buy Oneida. We need to stimulate our own economy. So we want to thank all the employees that have been out there. We hope that the links that we provided you on the small business is helpful. So I'll make sure I haven't missed anything today. Let's keep the numbers down on the isolations. Right now we have one, as Debbie mentioned, and hopefully, you know, that person's out of isolation very, very soon. So we want to thank you for your respectful comments. We continue to watch the questions and answer them in the best manner that we can. And I just want to share a sentiment before we close, as we always ask you to continue your prayers, continue your support, to nurture the fire within yourself and to encourage the fire in all others. Skana, Oneida.